Good afternoon, everyone. My name is Dan Kuntz, and I'm a sales engineer at Call Tracking Metrics by day, but today I'm serving as a moderator here at Demo Day. It is with great pleasure to introduce Sam Hessler, a seasoned professional with over half a decade of experience in behavioral health. Today, Sam will be sharing valuable insights on Dazos. So at this time, I'd like to kick it over to Sam so he can tell us a little bit more about himself and the Dazos platform.
Yeah, thanks, Dan. Great to be here. Do we want to take a minute or two to let anyone else switch over, or should we just dive right in?
Yeah, we can give it a couple minutes, let some folks start piling in. So Sam, while we wait, could you tell us a little bit about yourself?
Yeah, certainly. Um, so I started in the behavioral health industry coming up on 10 years ago and kind of worked on the admissions marketing, go to market side of things. I'm actually kind of a longer time CTM user than I am a Dazos, user and staff member. So I've been using CTM both as a user and as an administrator for 7, 8 years now. Big fan as you guys know. So to be a part of something like this, uh, it's a little bit of a dream come true. In so many words. So big fans of CTM. I've got some slides talking about how that partnership benefits our customers and us and you guys. So I'll spend some time talking about that. I think we can probably just go ahead and kick it off. So I've got a little slide deck, just give everyone an overview of kind of what Dazos is, a little bit of our story. So my name is Sam Hessler. I've had the pleasure of really helping to build and lead the sales team since we really started going on 3 years ago. Dazos is the only revenue and admissions growth platform specifically for the behavioral health and addiction treatment industry.
Oh, very cool.
Yeah, thank you. Yeah, so currently, based on year over year growth, we're the fastest growing tech company in the behavioral health space. Right now, we're the most used behavioral health specific CRM, and our solution is really it consists of two kind of core products. We've got our advanced CRM, which we're going to spend some time talking about, and then we've got our billing analysis tool called IQ. Um, Both of these have been, absolute game changers, and it's been a real treat to just, play a role in that and kind of watch this company go from, having just a couple customers, when I joined to, a couple hundred now. So myself included and our founding team, we were building and managing behavioral health companies all over the country. Um, for us, the reason that Dazos, came to be is because we saw that um, ultimately the healthcare industry was really neglected from a technology standpoint. If you look at like other, just big tech companies like sales organizations, like et cetera, just other big companies and other big industries, healthcare was really a couple steps behind. And then in that industry, behavioral healthcare was even more neglected. And relative to, the options that were out there for other verticals, we saw that in behavioral healthcare, it was very limited. We kind of found ourselves with only a few options, which was to take something like Salesforce, which is a great CRM. Um, it's not built for any one industry, but people in addiction treatment might take it and spend tens or even in our case hundreds of thousands of dollars to customize it to make it work for addiction treatment. And not only do you have the monthly fees, but every time you want to further customize it or build it, or if you grow and you need new functionality, there's additional fees. And then addition to that, you have the time and all of the resources that it takes to administer something like Salesforce. So we saw that it was either something like that or use like kind of there are a handful of like CRM add-ons, that are pre-built for the industry. For us, they were pretty limited, and we weren't really able to get the functionality we needed to run 10, 15 location organizations, and they really didn't have the ability to like grow with our needs. And then the other option is just to do some crazy stuff in Excel or Google Sheets, or pen and paper, which is, I think, more common than you might think in 2024. And so for us, we went with option A. We were Salesforce users. That's how I spent most of my career, was just building and using Salesforce for addiction treatment facilities. And we were able to get I think some of the things we needed. We were probably easily $500,000 into a Salesforce build, and as we continued to grow, we realized that we were probably another $500,000 away from getting Salesforce to do what we needed it to do. And so one of our founders, David, who has a tech background, he was like, hey, instead of just continuing to dump this into Salesforce, I bet I could build something even better for this industry. And so that's how Dazzos was born. That was 7-8 years ago. We eventually exited the behavioral health space. So we sold that rehab, and we separated Dazzos, the tech, from this group of rehabs, totally separated it. That was about 3 years ago. That's when I came on board. And so since then, we've had the, craziest growth I've ever seen or been a part of. We've got kind of two key sides to our product line. We've got the CRM, Customer Relationship Manager, and it's an admissions and marketing tool. It's the only advanced CRM built specifically for addiction treatment. Part of what makes the CRM so great is the built-in insurance verification piece. So we call that iVerify. As a lot of you guys on this call probably know, so much of modern healthcare, especially over the last decade, is based on private health insurance. And we've got a built-in insurance verification tool with projections, with auto re-verification, with some other really cool features that our customers love, and that they really expedite the admissions and marketing process. On the other side, the IQ side, we kind of had these pains as operators, in that we spend all this money on marketing to get our name out there, to put our program at the forefront of Google or billboards or advertising or whatever. We spend all this money to generate leads and admissions through marketing efforts, and we render the service. People have good outcomes, and the insurance companies don't always pay what they're obligated to pay or what they're supposed to pay. And so we tried using, probably over a dozen third-party billers. We tried doing billing internally. What we ultimately saw is that you're not going to get max performance if you're not paying very close attention to your billing and revenue cycle management data. So when people go to treatment, they have insurance. You send their insurance a bill, a claim, and then the insurance either they pay some of it, or they pay none of it, right? That's the oversimplified version of it. We created IQ to really be a tool for us to figure out, are we getting paid what we're supposed to get paid? And in addiction treatment, anywhere from 75 to 100% of your revenue is coming from insurance reimbursement. So that can be, for us, it was an absolute game changer. It was anywhere from 10 to 15% of our revenue in any given month was coming from this IQ tool. And then finally, this is kind of a newer offering, is the marketing insights. This, and again, we're going to spend time talking about this, but this actually allows you to see your different admissions and what channels they're coming from, whether it's boots on the ground marketing, web campaigns, email marketing, alumni, and not just see your cost per acquisition, but to actually see how much revenue came from those admissions, and to really look at your ROI and just to make more intelligent decisions. So it does this automatically by linking your billing data and your reimbursement data to your admissions and marketing data. So that's kind of our product line that our customers really love. We've got some pretty cool stuff on the horizon that you guys will be hearing about shortly. The CRM, which is I think has become our flagship product. What people like about it is you kind of get both sides of the coin. So it is pre-built for the industry. It works out of the box. I'll give you guys a little demo, and you're going to see that it comes preloaded with dozens of modules, reports, workflows, automations, dashboards. We have probably, of our few hundred customers, we've got customers that will literally just use this turnkey. They will sign up, they'll use it how it comes out of the box. They will make almost no or zero customizations. They'll use it exactly as it comes out of the box. We have other customers that will customize and configure just about the entire thing. And they will make like a unique tailor-made solution for their business. And then we have people everywhere in the middle, right? Everywhere in between, from no customization to complete customization. And one of the key differences for us is that we've invested so much time and energy into our user interface and our UI that you don't necessarily need to be a trained Salesforce developer. You don't need to know any code. It's no code. It's all drag and drop and very clean and simple user interface. So what that really means is that anybody can become a Dazzos administrator. Anyone with just the most basic like tech and kind of logic understanding. And that's all with the kind of the support that we provide. Something that I've always loved about call checking metrics is your guys' support. I think there's been many times where I've just literally called in call checking metrics. A human being answered the call, and my question was answered in like 5 or 10 minutes. And I think that's just so rare. Sadly in modern tech. And so the phone support, the knowledge base, the forums, like those are all just things I've loved about CTM as a user for all these years. So we've definitely, tried to emulate that, to the best of our abilities, just because we've seen what a good user experience can be. We've got integrations with all of kind of your modern tech stack for addiction treatment. So it starts on the VoIP side, and we can show you guys this, but phone call, web form, live chat, a new lead comes in, it populates automatically into the Dazos CRM. Call checking metrics is for sure, I think, our best integration. We've got pieces of that integration that I haven't seen with anywhere else. I don't know if you could do it in Salesforce, and if you could, I'm sure it would not be easy or cheap. But we've got some really cool pieces of the CTM integration. It'll log in and outbound calls, text messages. We actually, literally Monday, released a new feature to actually automate sending of SMS texts through CTM using workflows. So I was really excited about that. We've got integrations with all the biggest EMRs in the space. Everyone on this call, Kipu, a couple others. And so the idea is new lead pushes into the CRM, admissions and marketing team compiles the info using our built-in verification tool, completes the assessments. We've got a whole bunch of other kinds of features. And then at the click of a button, it pushes over to the EMR. And I think a lot of our customers really like that because it minimizes the amount of systems that your admissions and marketing team have to use. It's a bidirectional integration. So when the patient discharges, updates to the CRM automatically. They come back in as alumni. It automatically tells you who to follow up with and when. And what I've seen, just as an operator, is that anywhere from 20% to a third of your monthly admissions can come from your alumni team, which is a chilling statistic, ultimately, because the only way you win is if people don't come back. But we know that addiction treatment has relapse rates comparable to heart disease, right? And um, ultimately, when people do slip up, you want them to have a safe place to land.
Yeah, absolutely.
So specifically, regarding how we work with call tracking metrics, again, I've used and implemented call tracking metrics at dozens of behavioral health programs. We use it currently as our internal tool, of course, right? For our sales team, and our support team. We've got queues built out, things like that. We use our own CRM, of course, as an internal tool, right? So we use this internally. This is typically what our customers, when they ask me like, hey, what's like best in class? This is my just candid recommendation. Um, CTM, I know you guys like have business and interests outside of behavioral healthcare. I think it's been really cool to see over the last, I don't know, 5 years. You guys have seen that opportunity in behavioral health, and clearly this webinar kind of validates the fact that you guys are seeing this as a bigger and bigger opportunity, and so for us, behavioral health, it's 100% of our business. Like this is what we do. This is kind of who we are. It's been real cool to kind of meet and build relationships with partners like call tracking metrics. The CTM user interface and UX is, in my opinion, second to none. Everything I learned about CTM, I pretty much just did by logging in. And I mean, the navigation, it's so easy. I took the CTM University. It breaks it down into like 6 1-hour sessions. The knowledge base is amazing. You can just search for anything you might be struggling with and either get answers from the staff or from other CTM users. So like that community, I think is really huge. I touched on a little bit your actual customer support and what that's like to actually call in. And then just for me, what I like about CTM is that I feel the same way I feel about Dazzos, which is that I have like complete and utter control over every aspect of my VoIP platform and my phone calls and my inbound and outbound um, VoIP system. And with Dazzos, I took we took a behavioral health CRM, made it work for a SaaS company. Same thing with CTM. I took that, I built it out for behavioral health. It was super easy to just modify it and make it make a little bit more sense for a software and SaaS company. So for us, it was a no-brainer. Best VoIP, best advanced CRM for behavioral health. Like that was like peanut butter and jelly for us, and I think our customers get a lot of those add-on benefits as well. So some of the things that specifically I think people really like are the fact that it's what we consider a standard integration. I think all but like 2 integrations that we have are standard, so we don't charge an extra fee for it. You can map users in the CRM to agents in call tracking metrics. So if I answer a call in CTM, it'll automatically assign that file to me in Dazzos. You can map custom fields to custom fields. So anything really that can be made available through the CTM API, we can map. CTM, for those of you guys that don't know, Q4 last year, I want to say December-ish, they released AI transcription, which is it doesn't just transcribe the whole call word for word, but it actually will summarize a 20-minute call in 2 or 3 lines. And that's something you can map to Dazzos. And ultimately that can be kind of like your initial call note when you go into the CRM. And then I think the biggest thing from a big picture perspective that our customers, like the reason they couldn't live without CTM or the CTM Dazzos integration is for the paid ads data and that mapping. In addiction treatment, it's pretty normal to have anywhere from a $5,000 to a $15,000 cost per admission, which means if you might spend $150,000 in a month with Google, let alone less any management fees, et cetera. And you can actually say, okay, this was our budget. This person clicked on this ad Wednesday or Thursday, May 16th at 1:35. They called this number, they spoke to this person. There's a unique identifier called the GCL ID, the GCLID ID. That all maps over, and then ultimately Dazos pushes back to Google Ads and says, hey, this click led to this admission, this conversion, which led to this revenue. So people love that because especially as you get up into the 5, 6, and even 7-figure marketing spends, um, if you have a slippage of 5, 10%, I mean, that could be tens or hundreds or even millions of dollars that's slipping through the cracks. So people love that for sure. Um, iVerify, that's our built-in insurance projection tool. It's not a white label. It's not an integration. It's our own proprietary software. And then IQ, that's the billing and revenue cycle management analysis tool. So it takes all your data, all your billing data, scans it, and it tells you where you're missing money. As simple as that. And so there's plenty of features, kind of places we can talk about. I wanted to at least give you guys a couple minutes of a demo. And so what I can actually show you guys is the process of a new phone call. So let's say Renee, our new amazing marketing director, say she reaches out. When she calls in, and looks like she's calling in right now, I answer this call in CTM. Admissions, my name is Sam. Thank you so much for calling. Who do I have the pleasure of speaking with? It pops up in CTM, and then with just the click of a button, it can take me to the lead that was created from this phone call. Now, in this particular case, Renee has actually she's actually reached out a couple times, so it'll actually take me to her existing file in the CRM, and I can actually see the historical data. So I can actually see everything that's going on with Renee. I could actually look in, I can see she first called in April 24th. She called in again on the 26th. She called in again this morning when we were testing and making sure there were going to be no hiccups for this webinar. And then she called in again just 60 seconds ago. And I can see from the notes, she spoke to Gordon. She called in looking for detox. She wants to admit next week. We still need to do the assessment. So if I was working with Renee, I would go in, open my assessments tab, complete an assessment with her, and then just push her right into my EMR of choice.
And I love having those comments readily available too. I'm sure that helps them do so much, keep track of their different patients that they're helping.
Yeah, great insight, Dan. Yeah, because especially what you'll see, I think in addiction treatment, that's pretty unique, is you'll typically have a team of people. When you first open, if you've got 10 beds, you might have a single person that manages all admissions, 7 days a week. That was me for some periods of my life. But pretty quickly, as you grow, you'll see that unfortunately you just can't choose what time people are ready to finally get help, and you're going to get calls at 3 a.m. That's like, hey, I'm finally ready. Like, I need help right now. I might not make it another hour. So having having teams that can be, first shift, second shift, third shift, 7 days a week, around the clock, or even just first and second shift, and then having the ability to communicate with different team members, that can be absolutely quintessential. So if I'm the overnight person and Renee calls in, I don't need to call somebody at 3 a.m. I can just look in the CRM and see the notes. So we love our CRM for things like this specifically. The whole thing is customizable. What you're seeing like today is kind of our default build out. And again, a lot of our customers will use it just as it comes out of the box. Other customers will completely customize the whole thing. The last piece, I really want to make sure you guys get a peek at is our billing analysis tool, which is IQ. And so again, this is a billing analysis tool. This doesn't replace anything. There's nothing like this currently. It takes your billing data, whether you're using Collab, Advanced MD, Avaya, any of the other RCM solutions. It puts it in it puts it at your fingertips and it helps you identify additional revenue opportunities. So it'll tell you, hey, this claim didn't pay, this claim underpaid, or this claim paid the right amount. And then you can work through that list, make sure that you're working either with your billing team or your third-party biller and getting the revenue that you've earned. One of the features in IQ that's become kind of a fan favorite is the marketing insights tool. And so what this will do is it'll actually pull the curtain back and really allow you to see the truth about your marketing efforts. So I think it's not completely uncommon to be able to calculate a CPA. How much did we spend and how many new admits did we get? What was our cost per admission? But to be able to actually say how much revenue came from those admissions, that's what IQ and marketing insights brings to the table that no one else does. So if I were acting as a chief marketing officer or a business development director, I could see all of the different channel partners or referral partners that I'm working with. I could see, if I was looking at this, that Healing Hands Recovery in this date range sent me 4 admissions. And those 4 admissions brought us $94,000 worth of revenue, which is amazing. And if I were looking at this, I would say, oh, yeah, that's our best referral source because they've sent the most patients. But if I had IQ, I could actually see that although Mountaintop Rehab sent me half as many patients, those patients provided twice the amount of revenue, $218,000. So you can look through 5 different lenses. You can look at channel partners. You can look at different campaigns. You can look at different lead sources. And people really love this. I have a question from Chris. Does your Google Ads campaign data automatically show up in that marketing insights? How is it passed through? Yeah, great question, Chris. So yeah, it does. The way it works is you've got this section called marketing info, and there's a different section typically called web traffic info, and that's where you'll map or will map for you this PPC or Gclid data. So if I go back to like something like this is where I can set up the mapping to answer the Gclid ID, which campaign, which keywords, what were the ad groups. And ultimately, as I go from a lead to an opportunity to an admission, you can then utilize our integration with Google Ads to upload an offline conversion. And in addition to this like specific granular PPC data, you've got by default, 8 different fields that are kind of used to say where did this lead come from. So you've got lead source, campaign source. This is the field that would typically say like, okay, this is tied to the campaign for local alcohol detox, etc. This data comes from call tracking metrics. So typically you map the tracking number and the tracking source to fields in Dazzos. And then same thing here, if you go into like the visitor details section, this wasn't a PPC call for us internally. So this is blank, but this is where you would see the Gclid ID, the campaign data, the source data, etc. And then, yeah, all of that, ultimately IQ, these 5 fields, these 5 lenses, those are correlated to these different fields in the record inside of the CRM. So yeah, really good question, Chris. Thank you for that.
Yeah, thank you, Chris. And I appreciate all your insights on this, Sam. It's been such a pleasure hearing you talk about, your platform, just hearing more about your journey. And you've been an amazing advocate of ours and both Dazzos. And it's clear that you're very passionate about the industry and having those resources available to properly help those patients. So it's been really good experience, and it's awesome to see Dazzos in action and how we work together with call tracking metrics.
Thank you, Dan. Well, I know you guys don't want to be late because I know we've got a pretty amazing speaker up next, but I will stay on for a few minutes if anybody does have any kind of additional questions. And definitely feel free to come see us at NATAP, come see us at West Coast Symposium, and then you can also scan this QR code to to just book something on our calendar if you guys want to chat more. So thank you guys
Awesome.
again. Thank you, CTM and Dan and Brian and Francis and everyone. And you guys are in for a treat. I know we've got some pretty amazing speakers lined up for the rest of the day.
Awesome. Appreciate you, Sam. Thank you for joining us today.
Thanks for having me.
Bye, everyone.